help.
There's well-documented evidence about what safe levels of drinking are.
I know my body. Your opinion is totally different from my experience.
Sure.
I'm going to tap on the legs, and I want you to say yes when you feel me tap, OK?
Sorry.
How much are you drinking at the moment?
As much as I can. I start drinking first thing in the morning. As soon as I open my eyes, I drink till I pass out.
They're feeling any easier?
Yeah, feeling a lot easier.
Curious, aren't you?
Barnaway Surgery, Cindy speaking. How can I help?
Hello, I've got an appointment booked for my son, Louis Hugh.
What's up, Annie baby? You didn't bring in any chocolates?
Hello, Evelyn.
Oh,
You've been good?
Well, don't know about that.
Try to talk him out of it.
Yeah. Have a seat there.
She's not been too bad.
Oh, okay. You've been good?
Yeah, no more practicing for the Olympics.
91.
Yeah, 91, runs rings round me. She's got more marbles than I have.
And though it looks red, it's not
Painful. Don't want to leave the remaining skin.
Trouble is your skin's so thin,
Yeah, I
it
know.
tears,
I do
so
know.
it's like... You'd make a great tissue.
Oh, dear.
Oh, that's lovely. Take that off. It's great.
Does it feel itchy?
At the top part.
Does it look better?
Let's have a look. It looks like the fluid is gathering at the bottom there. By the time you finish your antibiotics, yeah?
But can you imagine when she rang me and said, I've scratched my leg?
Oh, dear. Yeah, yeah.
It's not what I class that. Look.
You wouldn't classify that as a scratch.
A scratch.
That's a scratch.
Scratch.
And tell her why you've got
And yeah, these are scratches from doing her garden.
Oh, did you?
It's lovely because that's the first time I've had to ask any of you to do things like that.
Yeah?
Yeah.
We intend to do things like that, but by the time you get round, you've already had done it.
Yeah.
Oh, she's already done it.
Oh, she's worse than a child.
Oh, it's good to be independent, but
there's just really unnecessary.
you still got to look after yourself. All done?
Yeah, I'll have to get the girls to cut my toenails.
That's down to them. I don't do feet.
No, but they do that, don't they?
Yeah, they can do that. I don't.
All right.
That's my granddaughter's.
Oh, she's gonna do that.
They're beauty therapists, so they're used to feet.
Oh.
That's why I'm so used.
Yeah, there you go, Thelma.
Well, you're such a stunner.
All done?
Yeah, you're lovely.
Yeah, and...
Oh, how lovely. She's my friend.
Well, I'm going to leave you here then if you carry on like that.
Mind that chair, mind that chair.
I know.
Yeah, all right. Okay, we'll see you on Tuesday.
Yeah, definitely.
Right?
Thanks,
Okay.
hon. You
All
have a
right
lovely
then.
weekend.
Okay, you too. Bye-bye. Bye-bye. Bye. Bye.
I send apologies to you.
You apologise to
You were the first person that I blamed for that. You were. Then it was Riff. Then I found out it was Little Miss, but I wouldn't melt in her mouth.
I wouldn't do anything so infantile.
I thought it was very clever that she thinks my bits and boobs look like that.
I put the red dot in the middle afterwards.
You think the other one's inverted?
Yes. Got an inverted nipple and you see a doctor.
There we go. I'm Dr. Tawana. Nice to see you.
Nice to meet you.
How are you?
Thank you. Unfortunately, it's Louis who
think we're unwell.
Okay.
Yeah, he's just got a temperature today.
Yeah.
37.9.
Okay.
Last time
you checked,
Yeah.
okay. We say up to 37.5 is normal.
Right.
Okay, so going up to 37.9, it could simply be that he is warmer.
Right.
And that his body just hasn't been quick to regulate his body temperature. How long has he had that kind of gentle kind of rise in his temperature?
That was this morning.
Just this morning?
Yeah.
Okay.
Also, his nappies are smelling a little bit stronger than usual, but
yeah.
only by a tad.
Okay, so and that's urine rather than the poos, would you say?
Poo seems sort of normal.
Is he peeing normally?
Yeah.
Yeah, that side of things is fine. Good. Hi, young man.
Hello.
Hello.
Can you say hello to the doctor?
Has there been anything coming out of his ears at all?
No.
Good. Temperature 37.7, so it's kind of just slightly above the kind of threshold. If you hold him looking towards you, I'm just going to have a quick check in and around his neck. Talk to Mummy.
Hey.
Say hi.
Are you not going to say hello to me? Louis.
Okay, so no glands that I can feel. And actually, while you're holding him like that, I'll have a listen to the back of his lungs. That's it, that's lovely. Perfect. Okay, if we swivel him round just a little bit, actually, if you wanted, you can lie him down across your laps. I'm just going to press on his tummy. That's perfect, just as you are. Hi, young man.
Hi.
Lips are moist, which is very good. Hi. He's got a lovely colour about him. He's not struggling to breathe, which is brilliant.
You enjoying that little massage there?
Yes. Don't normally get this on the NHS.
No.
That's a lovely smile there, young man. We're going to shine a light just in his throat, just to see how that looks. Here we go.
Good boy, aren't you?
Very quickly. It does make them gag a little bit. All done. Perfect.
Okay, good boy.
So, no sign of any obvious infections there. He's well hydrated, lovely colour, breathing beautifully. No sign of any infection anywhere. You look very well, young man. So no concerns from my point of view.
All right. Are you happy?
He certainly is. He looks it.
Thank you so much.
You're most welcome.
Right, say bye to the doctor now.
You're going to wave? We're going to wave. There's a bit of a kind of opening of his hands there. Fantastic. Take care.
Okay,
All the best. Bye.
Bye now.
Hello.
My partner comes in with
That's all right, as long as you're happy.
Yes.
Yeah? Yeah, have a sit.
Thank you.
My name is Dr. Bajola. And how can I help you, Gary?
I suffer with alcoholism and I've been drinking for 30 odd years and it's made me ill. I've been in hospital. The last year or so it's cost me my marriage and I'm getting iller and iller. And I really now know I need help and I want to get better. I know you ain't got a miracle pill or injection, but please, I need help.
So I understand your main issue is alcohol problem, and obviously it's affecting your life now.
Yes.
And you want to be
Stop.
cleaner.
Yes.
So how much are you drinking at the moment?
As much as I can. I start drinking first thing in the morning. As soon as I open my eyes, I drink till I pass out. Wake up, drink again, till I pass out. Sometimes I don't eat for 3
What do you
4
drink?
days. Anything. But this morning, last night, I promised my
Stella,
grandson I'd never
how many
drink
cans
again.
does he normally have?
Between 8 and 16 a day.
8 and 16 a day.
Yeah.
Anything else does he drink?
No, not really.
No?
But
This
if
morning
he-
I got up and drank her vodka.
Yeah.
I found vodka. And that's
Yeah.
what I've done.
Have you seen any alcohol treatment before?
Yes, years ago, but I keep thinking I
Many
can get
years
myself
ago.
better.
Many years ago.
All right, okay. Yeah. Are you
But-
eating all right?
No, I don't hardly eat at all. I don't eat.
All
If I
right.
could go 4 or 5 days with no food, I don't care if you put me to sleep.
Can I have a look at your hands?
Oh, that's my
Yeah, we showed the doctor your hand. That's what you told me the other day.
Oh, just
Wow.
see, I punch things. I get so angry.
You gonna
I
make a
trust
fist?
it's all right. It's a little bit sore, honestly. But it's not about that. It's
Can I have a
about,
look?
it's
look
in there.
Okay, that's all right. Okay.
But this is the first time I really know I need help. I can't do it on my own.
I need to give you the phone numbers and address where you can see this alcohol nurse, You see them, they assess you, they'll ask for the blood test, and they give you community detox. Yeah.
I'll try anything. Yeah.
Because what we have done studies in the past where I can give you tablets, but without support, it never works. Yeah. I don't want you to stop drinking all of a sudden, because then you will start having withdrawals and you could end up having fits, which is not right. Okay. Regarding this punching, I think it's better to have an X-ray.
That's okay. It's just a little thing.
If you want to have an X-ray, I can book
That's
it.
fine, honestly. It's not.
If you change your mind, let us know. Yeah, okay?
Thank you very much. You can't just stop drinking, can you? You're going to get help.
So, Gary, this works as a self-referral. So, if you're committed, you need to ring them and make an appointment. Yeah?
Yeah. It's a long time.
Okay. That's a blood form, which is very important. So, once the bloods are done, make an appointment after 4 or 5 days to see the doctor to discuss the blood results. And once they assess you and bloods are done, and if you agree with it, then they will give you community detox so that you can stop drinking. And then after that, they give you support so that you don't start drinking again. You can also go to Alcohol Anonymous as well once you're clean, so that helps you. Or you can start now if you're really keen on it. Okay. All right.
Thank you.
Thank you very much, Doctor.
Okay.
Thank you for your time.
All right. But don't stop drinking all of a sudden. Yeah? Okay?
Thank you.
Okay.
Thank you.
Yeah. Bye.
Bye-bye.
When I was a kid, I got some glass in my foot and it'd gone septic. So they took me to Children's Hospital in Sheffield, and literally all they did was local, cut it out, but there was a big mirror there. They're going, you can look if you want, and I'm going, no, thank you.
I would have. I'm into all that gory stuff.
What we're going to do is an ellipse excision of epidermal cyst, because that's what I think it is.
Yeah.
Of scalp. Okay, so reasonably low risk procedure. But there are potential risks because it involves cutting skin. So I just need to let you know about that. So infection is one of them.
Yeah.
Bleeding.
Yeah.
If we get the cyst out whole, then the chances of it coming back are much less. Not impossible.
Yeah.
Still a little cavity on it.
Yeah.
If we break the cyst, then it's much harder to get the whole sac out. And so actually that increases the chance, and we don't know until we do it. Because it depends on whether I nick it with the scalp.
Yeah.
So if you can sign away, unless you want to ask me anything.
No, that's fine. You explained it properly to me. Did you go anywhere or just took time off?
No, so it was a fasting month. So I was just taking time off to basically survive the last 2 weeks, really.
Oh, okay.
So
do you feel grumpy and no food or?
No, actually, it's more fatigue. It's more fatigue. Eating and drinking is not a problem. You get kind of sort of accustomed to it, yeah, absolutely. But yeah, I'm back to the land of living, which is good news for you for today.
What happened to your bits and boobs straw? Alison got rid of it when she came back because she didn't like it. And now there's bits and boobs everywhere.
This is my girlfriend. Nice to meet you both. How can I help?
Benzoyl peroxide.
Okay.
I was wondering if I can get some sort of benzoyl peroxide.
Yeah.
On my face.
Yeah, to get some more, yeah. Okay.
Epiduo or something. We was talking about Roaccutane.
Yeah.
I think that was Roaccutane, but he was on about saying I need to get referred to the hospital or something for that.
Roaccutane is actually a brand name for the drug isotretinoin, and we use this medication in cases of moderate to severe acne, but more importantly in patients who we think are at risk perhaps of developing scarring as a result of their acne. So your acne, is it mainly just in your face, or does it affect your back and chest?
I don't know.
It's mostly the shoulders.
Yeah, my shoulders.
Shoulders and then the face. Yeah. Okay. So, how long have you been having treatment for your acne for?
I mean, I've had it for about 5 years now.
5 years,
I only
okay.
started getting treatment about 2 years ago.
Okay. So, what we do next really depends on you. We can keep going with the cream and the tablets if you think that it's making visible differences for you.
I mean, at the moment, I'm using tea tree oil.
Okay.
Just like putting a bit of that on my face just before I go to bed. It burns and stuff like that, but like I get up in the morning, I have felt a significant difference.
Okay. Yeah, that's
smoothness
fine.
and stuff like that.
I would say, looking at your skin, I'd classify this as moderate to perhaps quite severe acne in the way that it's presented on the face. And so my recommendation anyway would be that if you've tried for 2 years and it's still at this point, I think certainly a referral to a skin specialist and consideration of that specialist medication or Accutane is certainly worth considering.
Yeah.
Unless you have some objections to that, unless you know.
That's fine, yeah.
Okay. When the dermatologist sees you, he will go through some of the risks and benefits of this medication, the Accutane, because it's not entirely straightforward. There are some side effects that he'll probably go through with you.
My uncle's partner had acne and she had Accutane and stuff like that.
So you kind of...
She was saying that it burns and stuff like that.
Yeah.
It made a hell of a difference.
Isotretinoin does require a lot of monitoring. It has been shown in some cases that the medication can have an effect on your mood and behaviour, and there have been some reports of people perhaps having thoughts of self-harm or even suicide with this medication. And so therefore it's usually initiated by a skin specialist or dermatologist. Okay, so what I'll do a referral and we'll give you some Epiduo and more of the tablets today. There you go, okay. You'll hear from dermatology in the post with the appointment details.
Lovely.
All right,
cheers,
take care.
Sorry. Right back and right up, and you've got to make yourself really comfortable.
Okay, so the first bit, nothing fancy, I'm just going to draw on your head. Okay, so you're just going to do a sharp scratch now, okay? I'm going to put a little drape over you as well.
Okay.
Just thinking, can we move that? Probably there. That's good. I'm just going to check. Can you feel any of this? No? I'm not feeling nothing now. It's really tense, isn't it, the scalp? We put a vessel early. Got a very nice vascular scalp.
Oh, have I?
Yes. So it's oozing away nicely.
Good, good.
So we've got the cyst out.
Okay.
And it's come out whole, which is good.
Perfect.
I'm sorry if I grab a few hairs doing this.
No, no. Leave me some, please. Okay.
And it's come out whole, which is good.
Perfect.
Just try and even the scalp out for you, that's all. I'm just going to take this off, and I'll just give it a bit of a clean thing. This is the hairdressing bit now. So again, you won't thank me when you have to take this off, but it's good for now. So 2 days, yeah, of keeping this dressing that we're putting on.
Okay.
It did bleed a little bit, so if it starts oozing through today, if it's going to happen, it's going to happen during the daytime today.
Okay.
And I want you to just walk in at the front desk and point at your head to the receptionist, and they'll find something. It doesn't happen that often, but if it does start oozing through the dressing, then I want you to come back.
Okay, perfect.
Okay, Mum.
All right.
Just sit forward for I've got some red streaks.
Highlights.
And the dressing, that remains on?
So sorry, yeah. So after 2 days, you could take all the dressings off,
Okay.
and you can leave it open and exposed to air.
Okay.
So that's the 2 days of completely dry and dressing on.
Yeah.
2 days time, take the dressing off, and then you can have a shower.
Okay.
Cool.
Yeah, no problem.
All right, good stuff. And the stitches out 10 days. Just let them know downstairs.
Yeah. Okay.
And that's
Brilliant.
it. That's your lot.
Thanks for your time.
Thank you.
very much.
Cheers. Bye-bye.
Bye.
See ya.
Emergency doctor said she's picked me in.
With the emergency doctor?
Yeah.
What's your name?
Alison Sloney.
Take a seat next door, please.
Hi, I'm Dr. Taylor.
Oh.
I'm here with you.
My son.
Okay. How can I help?
My back's pain, absolute shit. It's really bad. I can't rest. I haven't slept for 2 nights now. I've taken sleeping drugs, but I still can't sleep.
How long have you been suffering with back pain for?
About 20 years.
So this is an ongoing thing?
Yeah.
Okay. And I can see you've seen the specialist as well.
Yeah, he said he can't do nothing for me.
Okay. Have you had physiotherapy and things for it as well?
Yeah, they said they can't do nothing.
Okay.
So I'm in limbo, you know.
Hello, Samantha. Come on in and have a seat. I'm Dr. Bolger. We've met before, I think, haven't we? How can I help today?
Basically, I'm just struggling really with keeping the pain and the sickness under control. I've been vomiting since Wednesday, but I can't keep anything down now. Anti-sickness isn't doing anything now. I'm building that up.
What are you taking for anti-sickness?
Cyclizine 3 times a day. This morning I took my first painkillers about 5:15.
And which painkillers are we talking about?
Cocaine, tramadol. I took morphine. A couple of hours later, brought that up as well.
So you're taking tramadol, morphine, cocodamol?
Yeah. It's for
Right.
the chronic pain condition. That's escalating now because I can't keep the...
And what's the plan with the chronic pain condition?
I'm waiting to see Hammersmith Hospital again. They're looking at my pancreas and the secretion. They can't seem to find out what is going on yet.
Right, OK. So let's check you over.
Thank you.
Feverish with it?
Cold,
Yeah, hot and
I've had
cold.
diarrhea and it's sort of hard to know if I've got bug because I have these symptoms so often.
It does come very often now, doesn't
Yeah,
it?
but
Are you ever pain-free?
No, it's always there.
And they can't come up with any diagnosis for
No,
you?
they took my gallbladder out last year thinking that
I remember,
made it
yeah.
a bit worse.
OK, right, let's get you across. Let's check you over, yeah? So really, if we could stop you vomiting, you could
Yeah.
keep your painkillers down,
Yeah.
or you could keep your fluids, couldn't you?
That's it, it's a bit of
So
a cycle.
cyclizine,
Yeah.
which is a good anti-sickness pill. Have you been on any others?
They tried me on Dansetron, but that they worried we didn't track for my citalopram, and they tried me also on metoclopramide.
Show me where the pain is. Lift
Okay.
up for me. You're okay for me to examine you,
Yeah,
aren't you?
that's fine. So at
All
the
right.
moment it's here and it's going round to there.
And that's where it always is.
Yeah,
isn't
it keeps going shooting up to my shoulder. That's the worst bit.
Okay, that's fine. Come back
Thank you.
across. I'm trying to think of something we can try for the sickness that hasn't been tried. You just go through your notes. Because the other option is you going up to A&E.
Yeah, I just can't avoid. Only
I know, I
because
can understand that.
I'm in for a few days normally. I'm normally in every month, but I've avoided it for the last few weeks. But I feel like I'm sort of
on the edge.
Yeah, and I feel like I'm just being stubborn now. So I think I probably do have to go back in. But I think I'm just in panic mode at the moment. What's left to try about going back? But I think I might have to.
You've had the domperidone, they've tried it before. We could
Yeah.
try it short term. They're right, it's not a long term solution, but just to see if we could try and get you to keep some fluids down.
Yeah.
The other alternative is A&E. Should we
Okay.
try some domperidone at least during the course of today?
I'm happy to take some time.
I think if this doesn't work, then you need to either call us again or go up to A&E as you normally do.
Thank you.
It's no problem.
Where in the back is the pain?
It's just there.
Across the lower back. Yeah. Does it move anywhere or does it stay in the back?
It goes in my legs.
It goes in your legs.
And my fingers.
Okay. And have you got normal control over your bowels and your bladder? You're not having any accidents?
No, but it's like my bum's numb.
Okay. And has anything happened recently? Any injury or any trauma? Fine. What I'd like to do today is examine you.
Can you wait outside a minute, please?
Mm.
Thank you, Jonathan.
Okay.
Yeah. Sorry about this.
Not at all. You don't have to be sorry.
I'm
I'm sorry that you're in so much pain.
I don't normally come as a role.
What I'm going to ask you to do is just to lie on the couch for me. Can you just I'm going to tap on the legs, and I want you to say yes when you feel me tap, okay?
Sorry. Oh, God.
You okay for me to continue?
Yeah. It's really bad.
Do you want to sit up for a second?
Yeah.
Yeah. I'll give you a hand. Just take a second.
Oh, I feel dizzy.
I'll get a lady to come in. Got my colleague Hannah with me, okay? So I'm going to be examining the bottom, okay? So what I'm going to ask Hannah to do is just to kind of be with us when I examine you, all right? So I'm going to wind the curtain round. And if you just lower your bottom things, yeah? Okay. Okay, so all I need you to do is say, number one, whether you feel it, and then number two, I'm going to ask you to squeeze down on my finger. Okay? Okay, can you feel that there?
Yes.
Now what I'd like you to do is now try and just squeeze down on my finger.
That's it, I can't do it.
And just try one more time. That's fine, okay. Thanks. Alrighty. So, the reason I examined you is wanted to just make sure that there's no other sort of concerning signs that your nerves are being involved in your back pain, okay, which I don't think they are. It's not really a painkiller that you need, but actually something to release some of the tension in the muscles, because I think it's the spasm that's causing most of this pain at the moment. So there's something called diazepam, which you've probably had before. Yeah, and I would like to maybe try a short course of that, maybe 5 days worth, to take it 3 times a day, and that might just help ease the spasm. Now, obviously, in that time, if the pain gets worse, if you start losing control of your bladder, your bowel, or the numbness gets worse, then you come back and let us know. Okay? Let's try that and see how you get on.
All right,
okay.
then.
All right.
Cheers.
You're welcome.
Thank you.
Okay, take care. Bye-bye.
Jonathan.
One morning last week, we were walking across the by the Scalp, and some bloke's gone past with a dog, walked by, down that sort of alleyway. Short sleeve t-shirt and shorts. I thought, bloody freak. I had a jacket on, a scarf on, gloves on, and he's got a short sleeve t-shirt and shorts.
So a bloke walks past the house in the morning with the dog, and he's got his shorts on. I figured, that time of the morning, not awake then.
Okay, so let's have a look. So you had some bleeding, did you?
Yeah.
That's settled now?
I haven't done anything since, gosh.
Okay. So you're quite keen to start HRT? Okay.
I don't know what it is.
Okay, so it's hormone replacement therapy. So it's basically replacing the hormones that you previously had.
Yeah.
Okay. And when did you go through the menopause?
Oh, God, well, I didn't know I was. I'd say from when I had Riley.
Okay, 42. Okay. So you're using any form of contraception at the moment? Okay.
I ain't done anything.
Okay.
Got no sex drive, nothing.
Okay. And how are you feeling otherwise?
I'm a bit of a mad, a bit moody and, you know.
So the estrogen will help with that, okay? So there's 2 main female hormones, and one's called estrogen, one's called progesterone, and they do different things, okay? But we'd have to replace both of them. It has lots of positive effects, okay?
Right,
So, you know, and it has, you know, helps protect against osteoporosis and things like that. But unfortunately, estrogen has also a few not so great things, and that's why I don't know if you know about all the bad press that went along with HRT and things, that the risks of sort of developing blood clots.
But obviously you keep an eye on things like that.
Completely. So we would expect you to come in every 6 months, have a blood pressure check, talk through how you're feeling. But it's for you to be aware of, because actually they're quite, although the risks are very, very low.
Quite a serious thing.
Completely. Okay, so there's lots of good things and lots of bad things.
Scaring the life out of me now. Go on.
No, I just need to tell you, it is about trialling it, okay, and obviously doing all that you can to keep your risks down. I'm naming big names, but the risks are very small, but obviously the cancers of the womb and the ovary as well, but that's where the progesterone comes in, okay, because estrogen will build up the lining of your womb again, okay, which is a risk factor for developing cancer of the womb. So, so what the progesterone do will just shed it away, so you'll have a bleed every month like you used to.
Oh, really?
Yeah, completely.
Great. I don't get any now.
Okay, so it's just 1 tablet every day. I want you to come back and see us before you run out. If you develop any pain in the leg, in the chest, stop taking them straight away, see a doctor. Okay, have a read of the leaflet.
Will it be severe pain? I know it's not right pain, won't I?
It won't be something little, okay. But if you've got any concerns, please do come and discuss it with one of us.
If I just think something's not right,
just
so just not take the next one and then make an appointment.
Well, you can actually just speak to a doctor over the phone and say, look, I've just started taking it. Can I just check? All right, so don't worry.
Yeah, thank you very much.
Bye-bye.
Cheers, bye.
Oh, I'm having stir fry for dinner. Woohoo!
What are you having for dinner?
Stir fry. I haven't had stir fry in ages.
Are you making it?
I'm technically making it because I'll be putting my noodles with my stir fry and then like
put it all together.
That's a stir fry.
I'm putting it on my plate. Yeah. Kind of making it, I guess. You're stirring it in a pan? I'm stirring it and frying it.
Hello.
Hello.
Right, which one's John?
Me.
All right, have a seat, John. I'm Julie, how can I help?
Every time I breathe in, I get a pain in my chest.
All right, OK. How long's that been going on for?
Since yesterday. You can hear it.
Oh, I can hear the wheeze, yeah. And it's normally asthma, Mum, or?
Yeah, he's got a little bit of a tight chest.
Yeah, so has he used inhalers before?
No.
No. OK. All right, we're just going to...
When he was younger, yeah.
When he was younger?
Yeah, he was quite asthmatic, like...
Oh, he did have asthma when he was younger?
Younger, yeah.
Right, just stand up for me. That's it. Just breathe in and out through your mouth. You're quite wheezy there, aren't you? Just have a seat, John. Let's pop your finger.
Jimmy.
That's a good lad. Okay. So what I'd like to do is give him the nebulizer, okay, and then I'll check him again.
Is it very serious?
No, darling, it's just your asthma that's just come back, that's all. I'll give you the medicine through the mask.
Morning, Timothy. Hi.
Morning.
Come through, come and grab a seat. Thank you for waiting. Sorry about the delay, Timothy. How can I help today?
Right, I need a full range cholesterol test.
Yep.
And I've got a broken rib, at least one broken rib.
Okay, all right. In terms of medication, what medication are you taking at the moment, Timothy?
At the moment, just tamulocin, but I'm going to start taking my heart medication again.
Have you ever had a heart attack before?
Yes, I've had two.
Okay. And in terms of the heart medication, why did you stop the heart medication?
I was having too many side effects and...
Okay. The medication that you're given is very good medication. Has actually been shown to be protective after people have had heart attacks.
Yeah.
Okay. So patients who've had heart attacks, they should be on these medications.
Well, yeah.
Yeah. And Timothy, the other question I have for you is, in terms of alcohol, how much alcohol are you drinking at the moment?
Probably about 2 pints a day.
Okay. And have you tried to cut down?
I don't need to. I have a thiamine deficiency and I drink Guinness, which prescribed by a consultant 20 years ago.
Thiamine is a B vitamin, and its deficiency can result in multiple signs and symptoms, and it can affect the cardiovascular, neurological, and gastrointestinal tracts. Some of the signs and symptoms include nausea, vomiting, and fatigue.
I became deficient in thiamine, and I ended up being seriously ill for 9 months, and I ended up in hospital. And a friend took me out for a drink. I had 2 pints of Guinness and I was cured.
Most people associate Guinness with high iron content. Guinness or any other alcohol is not a recommended treatment for thiamine or iron deficiency. We can treat both of these with effective nutrition, and also if it's severe, we can give medication.
There's well-documented evidence about what safe levels of drinking are.
That's right.
And safe level of drinking for men, now the current guidance is 14 units per week.
Yeah, well, I drink 1 can of Guinness in the morning and 1 at night.
Okay, so 14 units per week, and you should have at least 2 alcohol-free days in a week. That's the safe
No,
limit.
if I had 2 alcohol-free days, I wouldn't be able to work.
So all it is, it's just the medicine, but it's just going through the mask, and it'll be like steam that comes out. Okay, so like steam in your face. You just have to breathe normally. That's it, good boy. Oh, it helps if I plug you in. Right, can you jump up off there for me, and I'll just start writing up his notes. That's it, good lad.
Hopefully you don't get worse.
So can you remember when he last used inhalers, Mum?
It's usually during the summer.
Just sometimes in the summer with hay fever, he might have some problems. And then does he use the blue inhaler? Don't press on anything, as it might all disappear.
Feel better, Jimmy? In your chest?
Are you feeling any easier?
Yeah, I feel a lot easier, but I can still feel that little bit.
Just.
Oh, no. Thomas is looking straight at you.
I have to.
You're very curious, aren't you?
Kevin. I'm gonna go back in. It's just I'm asking these two to stop playing up a bit.
Wait till that stops steaming. Just keep shaking it slightly just to get rid of those last few drops. Don't feel any better when you're breathing in?
Yeah.
Yeah?
I can breathe deeper now.
Good, good. So what I'll do, Mum, I'll give him some inhalers, and I just want to check his chest again. It's in your purse.
Kevin, well, talk to the nurse. Yeah, in a minute, Kevin.
Unless I have Guinness, I can't work.
Do you ever feel shaky in the morning?
No.
Do you ever crave the alcohol?
No. I don't even like the taste of Guinness.
My job is to make sure that you live until you're 150, right? That's my job.
And you just have to take it from me that if a consultant recommends that I have 2 pints of Guinness a day,
Yeah.
and I know that to be a fact.
Timothy,
Time and again.
I can assure you, as your GP today,
Yeah.
that it is not good for your health, okay?
It's important in our role as general practitioners that when we encounter patients who don't want to change their ways, that we don't get frustrated. And our job is to offer the correct evidence-based advice to hopefully allow the patient to one day change their ways and adhere to the correct treatment plan.
I know my body, so there's no point you trying to tell me that it's not.
Sure.
Your opinion on Guinness is totally different from my experience.
Sure.
I don't drink excess alcohol.
Okay. Now, Timothy, in terms of the broken ribs, tell me what happened.
I fell off a motorbike in Kenya
When was that?
about a month ago.
Soreness on the right side of the chest. have you?
Yeah.
What I want you to do is stand up for me. The pain, is that tender there?
Yeah, just a little bit.
Okay.
Yeah.
Turn around.
Broken rib is in
Turn
that
around.
area.
Okay. Take some big breaths in and out. And out. And again. And out. In terms of the chest,
I need an X-ray.
for a broken rib or for a query broken rib, we do not X-ray unless there's certain indications. That makes sense. Your chest is clear. There's no evidence that you have an infection in the chest, which is good. You've got good air entry on both sides.
Yeah.
Your oxygen levels are perfect, so you do not need an X-ray.
Right, so you're confident that the rib is healing up?
Even if it was broken,
Yeah.
we don't X-ray because the treatment, whether it's broken or not broken, doesn't change. It's pain relief, and it will heal.
No, that's not strictly true because if the rib is not healing correctly,
Yeah, because at the moment there's no indication for us to get the X-ray.
Right.
Keep going with the pain relief, and this should settle down. Okay.
Yeah.
If it's not settled down in the next 3 to 4 weeks' time, you come back in and see us.
3 to 6 weeks, a rib's supposed to heal.
So Timothy, in terms of moving forward now, okay, take the pain relief and let's see how we go. All right then, baby.
Thanks a lot.
No trouble.
So I think we'll treat him full on as asthmatic with the steroid inhaler and just to get on top of things.
Jimmy's not feeling well, Kevin, so you gotta just have patience.
Right, lovely. I think that's done now, isn't it? That's it. Good lad. Okay, so I just need to have a look at your brother again now. Okay, so you stand over there with Mum.
Good boy, Luke. Stand
That's
here.
it. Let's have you on the scales then. That's it. Okay, 48.
Stone.
No, that's kilograms. Okay, you jump up because I need to be here. That's it, thank you.
Kilograms.
Right, let me just check your chest again and then we'll get your medication.
It's a lot less squeaky than it was before.
Yeah. There's still a little bit of a squeak there, but it's a lot better. Sounds a lot better.
Luke, Kevin, why are you doing this, Kevin?
So he'll definitely need some steroids. Okay, jump up.
Don't steroids make you get muscly.
They might do, eh? So I'll give you a brown inhaler. Okay, so take 2 puffs in the morning, 2 puffs in the evening.
Okay.
and a blue inhaler. Okay, so the blue inhaler you take, whilst your chest is bad, take it every 4 hours.
So the brown one, 2 in the morning
And 2 in the evening, right.
Are we going in now?
What do you say, boys?
Twice in the morning, twice in the evening.
What do you say, boys?
Well done.
And
You take it to nurse, Kate? Thank you ever so much, nurse. I appreciate that. Lot.
All right then, take care. Okay.
Bye-bye. Say bye-bye, boys.
Get the stickers. There you go.
Thank you.
All right
Thanks
then,
ever so much.
bye-bye.
Bye-bye.
We'll see you next time. All right. Bye-bye.
Excellent.
Thank you very much.
No trouble. Lovely to see you.
Bye-bye. Sorry to be a pain.
You're not a pain at all. I'll see you in a couple of weeks. Yeah?
Thank you very much.
Bye-bye.
Bye-bye.
I don't know what you're doing there.
Ah.
Look at the face. Wow.
Lexi, come through. Come in. Come and take a seat. Hi.
Right.
Right, how can I help?
I thought she might have thrush. But the doctor said she might have a urine infection as well.
Okay.
So
did you bring a urine sample in?
I did.
Lovely.
It's happened in the past before. She's fine during the day, but then at night she starts really screaming and crying. It's hurting down below.
Yeah.
Really?
Yeah.
Okay.
So we didn't know what it was.
Okay, and in the last 2 nights she was saying this,
it's
and when
both.
you look down below, Mum, is there anything that you've noticed?
It's nothing. The inside is a bit red.
Any blisters, spots, anything
No,
at all? No.
no.
Okay. So you brought the sample, and
I
what
did.
we'll do is we'll dip the sample and...
It's in.
Oh, it's okay.
I put it in that's all I had to put it in.
Just don't drink it.
No.
Mummy.
Yes.
It's like weed.
It is. It's yours.
Is it her first morning one?
First weed.
Yeah, this is the wee.
Yeah, it
This
was.
morning.
It's my week.
Is it? No, there's no infection, so there's no blood. What I'll do is, can we have an examination? Is that possible?
Right, you're going to lay on the bed?
We'll just slowly have a look and just look. Is that okay? Do you want to come behind the curtain with her, Mum? Do you want to pop her on here for me?
Whoosh!
Can I take a seat? What can I do for Logan?
Right, well, we saw the doctor this morning about his, closed, droopy eye, and we were told if there was anything else to come back. He said he's getting a bit of blurred vision and double vision in that eye.
Look at me, Logan. No, not your game. Just look at me.
Let me hold that for a minute.
No, don't you.
I won't play it.
Why do you think it's droopy? A little bit full, isn't it? More than droopy, I would say. It looks like the lid's almost a bit swollen.
Yeah.
It is not.
Is it not?
Doctor felt and she couldn't obviously feel anything.
you.
Hang on.
Logan, will you do a few things for me?
No.
It's
Because you'll
it's on.
unpause it.
It won't. It'll be fine.
You do a few things for me, Logan. Copy what I do. Screw your eyes up as tight as you can. Really, really tight. Okay, and open. Lift, that's it. Eyebrows right up like that. Fantastic. And down. Blow your cheeks out. Go on. Okay. Now, follow my finger with your eye. Is that all okay? Now, this is the tricky one. Is that okay? Any problems with that?
I can even cross
You
my
can do it
no
yourself,
problem
but
with
did
me.
you only ever see one of my finger?
Yeah.
Yeah, okay.
Can I just feel your tummy? Any pain at all? No. So if a urine infection, you'd get pain around here.
Okay.
No, that's fine.
That's good to know.
No, that all looks normal, actually.
Okay.
But because it's been going on for a while, I think we should try the anti-thrush treatment, because you said you've tried pseudocrine and it's not healthy.
Yeah, it doesn't seem to do much,
Yeah.
to be honest.
Stand up for me.
That's it. I'll let you get ready.
Good girl. Right.
So let's give her a tiny bit of the canister cream that we normally use.
Right. We'll sit back up. Oh, there we go. Ah, can you share with me? Oh, thank you.
So just apply it twice a day.
Okay.
And just for 5 to 7 days maximum, like a
Okay.
week. There we go.
Sure. We'll get you some proper cream.
Oh, you're so sweet. Well, nice to meet you, Lexi. Oh.
Say thank you.
Thank you.
It's okay.
Right, come on then.
All right then. Take
Right,
care.
thanks for that, darling.
It's okay.
Right, you're going to say bye.
Bye.
Right, let's go. Thank you very
Bye.
much.
It's okay. Bye.
So you can get a swollen upper eyelid that makes it look like it's drooping because this is bigger in size. And I think that's what we've got going on here,
Right.
rather than the eyelid itself isn't moving properly.
Right,
Because his
okay.
eyelid is moving beautifully. So we give him some eye drops and it will all settle down.
It's not a problem, is it? We don't
What
mind.
are eye drops?
Eye drops, like liquid in a bottle, and we drop them into your eye.
Okay.
You can do it or mum can do it. But it's quite difficult to put your own eye drops in, even when you're a grown up, so I would maybe let mum do it.
Why
It's
don't-
tricky. I've had eye
Why
drops
don't you just
before.
put it in the shower and then just go...
All right.
Yeah.
Take care.
Thank you very much.
Nice to
What
see
if
you.
it doesn't settle down?
Well, no,
Then
we'll
we
have
keep
the
taking
I
them.
will have the pleasure of seeing you again.
Oh, the lovely pleasure. Hey, come on then.
All right.
Thank you
Do
very
bring
much.
him back if you're worried. Give it till Friday. If it's not better,
minutes.
bring him back.
Yeah.
Okay. Bye bye.
you.
Mercy flu jab. And 7 days, come back and see a nurse after taking these.
By a nurse, what do they need to take your blood pressure or anything?
No, she said to see if the infection has gone. In the ear. And flu injection as well. You know, do it all in one. Yeah?
We'll try.
Thank you. Does she look like Amy next door a bit? Amy? No. No? You don't think so?
I hope she's not ugly.
Hi, come on in. How can I help?
It's obviously a range of things.
Yeah.
I've had like a really bad cough for over a month now.
Okay.
My chest isn't wheezy. It doesn't hurt when I breathe. I'm
Uh-huh.
not in pain with it. But I get out of breath really quickly. Like now,
Mm.
I'm out of breath just from telling you that.
Yeah.
There's a lump or something in my ear. If I'm honest, this is gonna sound really stupid, but the symptoms that I feel now are kind of like the symptoms that I felt when I had cancer. I had trophoblastic disease, and it's just like all the little things. Like my mouth started, like the taste of food that I liked.
Yeah.
I'd gone off it, and it's like they're all the symptoms that I had
Right.
when I had to have chemotherapy, and they found out I had cancerous cells in my lungs.
Okay.
It just seems to be all the same.
Yeah.
I've actually really not been well for quite a while. But the main thing is obviously my chest,
The chest.
my
Okay.
ear,
Yeah.
and just generally feeling
not
the
quite
way
right.
I do. Yeah.
Okay. Holly had a rare form of cancer called trophoblastic disease shortly after she fell pregnant. What happened in her pregnancy is that the cells of the placenta and the growing fetus started to multiply abnormally like a cancer. In Holly's case, the cancer had spread to the lungs, and she underwent chemotherapy, which successfully treated the cancer. If we start with the chest, so you've not had a history of asthma in the past, you've never had to use any inhalers or anything like that?
Blue. I got given a blue pump, but it doesn't
Okay.
work. It
Okay.
doesn't do anything to me.
Okay. And you mentioned your ear. Did you actually feel a lump? Because I mentioned when you spoke to the doctor, there's a lump there.
It's like I can feel a lump in my ear, but I'm not sure whether it's my ear or
Okay.
whether it's swollen, but it's just really sore to
Yeah.
touch, and it just feels like it's inflamed.
And do you smoke at the moment?
I do smoke.
Okay, how much a day?
If I'm honest, like 10 to 15 a day.
Okay. Do you want to just take some breaths in and out of your mouth for me?
It's making me go lightheaded.
You all right?
Yeah, I just feel lightheaded from like where I keep breathing in and out
Okay,
a lot.
just breathe normally. Don't worry about taking deep breaths in, okay? And just show me this area on the ear that you mentioned that was...
It's inside my ear.
Any discharge from the ear?
No, ow.
Is it tender if I'm pressing there?
No, but if you like stick it in the way you did, that hurt.
I know obviously you're worried, given everything that happened in the past, that this might be signs that things are going wrong again. Any patient that's had a history of cancer, especially someone as young as Holly, it's very common to see anxieties later on in life regarding their health. However, in Holly's case, I was quite confident that the cancer that she had was very specifically related to pregnancy and therefore very unlikely to be related to the symptoms she was currently presenting with. When I listened to your chest, it sounded very clear. There aren't any noises there. Like you said, it doesn't sound wheezy.
No. It's just literally of the fact that I get really short of breath really, really quickly.
And there's lots of causes for why someone might become short of breath, and that can even be things like anemia as well.
Okay.
So I think the first thing that we could do is a chest X-ray.
Okay.
Okay. I was thinking of doing some blood tests, and then maybe we can catch up in a week or so once you've had those tests done, and kind of take things, from there. But what we could do is also refer you to our respiratory nurse, because this is the breathlessness. I just wonder whether this potentially could be asthma. The ear, when I looked inside the canal, it looked normal. Sometimes the canals can get a little bit inflamed and you can get sort of an infection in the external canal.
Okay.
There wasn't any obvious evidence of that today, to be honest.
Okay, yeah, no, that's great. Thank you.
Is that all right?
Yeah, I really do appreciate it. Yeah.
Okay.
Thank you.
All right, take care.
You too.
Hello.
So I'll cut straight to the chase. I think I know what it is. I slept funny. I'm getting this cramping sensation down my arm. It's like a spasm. It's not a heart attack, it's on that side, but it's just down there. I've slept funny, and you see it stay on my face. I can't even put my neck out, it kills. And I just wonder, I've got cocodamol from what I've been prescribed by the doctors. I shouldn't even say it's strong. I haven't slept all night.
Okay.
Oh, if you're going to...
Is it both sides or just this side?
But it's like it goes straight across my body.
And you were fine when you went to bed?
No, 3 days I've had this, but last night I haven't slept. Basically, it's like a spasm.
Yeah, you got a trapped nerve, haven't you?
Oh, is that what you feel?
Yeah, can you do that?
I can do that. That's why I didn't want to bother you.
Can you get it up to your head? Or have you never been able to?
I suppose I can. I'll tell you what happens. When I'm laying in bed, say that's my bed, if I put my arm across like that or lay down, it's all right. But my elbow keeps on locking, and it gets a bad spasm, like a proper, and it's like a gripping sensation.
All right, Jonathan, you stand up for me. Need you to do some movements for me. Can you take it backwards?
So that's
all right, forwards.
My arm's shaking nearly.
Yeah. What about up? Oh, you don't like that, right? Okay. What about behind your back like that?
No. Look at I'm shaking that.
Yeah. Okay, just relax for me.
Why can this always happen to me?
Okay, the whole thing's gone into spasm, hasn't it? Can I have your elbow?
That's all right, but
that's not so bad, is it? It's the shoulder and the neck.
It's not hurt. Hurting's not the right word. It's more aggravating because I'm not sleeping.
So we'll give you some diazepam and some naproxen. Naproxen twice a day with food, diazepam 3 times a day, and that should release the spasm.
Is there anything you can recommend? Not on tablets, but when I'm getting sleep, I need sleep. I'm so stressed.
Well, the diazepam will help you sleep.
Doing a desk job, I'll be alright, won't I?
Yeah, it'll be fine.
Just looking up in the air.
Yeah.
I went away with my work on a work conference and the bed was so hard I didn't get sleep.
Oh dear.
Oh, thank God for that.
All right, take care, Mr. Roberts. Bye-bye.
My throat's not sore, but see, right down there, on fire.
Oh dear.
So it's a little squirt up here and a little squirt up there, so that you don't get nasty colds. Little tickle. That's it. Good boy. That's it.
Excuse me, just a moment.
Great. Mr. Anwar, please. Hello. Come in.
I have got really sore throat. And it's terribly painful. Like yesterday, I couldn't even speak.
Yeah. That's what I was wondering, because you were prescribed some antibiotics yesterday.
Yeah.
So you've only had less than 24 hours of it. Is it possible for him to reduce the volume on the phone?
Sorry.
Sorry, just 5 minutes. You can do it on a... oh.
Sorry.
No problem. Don't worry. Okay.
Yesterday morning, when I spoke to the doctor, she said, any vomiting? I said, not yet. But I did vomit after, like, you can say, around 10-ish.
Okay.
And that was a yellow fluid. Yellow, thick fluid.
Okay.
I don't know what was that.
Have you been coughing as well?
Oh, yeah.
Yeah. It could be a mixture of sputum. Have you got any pain anywhere?
It's still in there.
Apart from there, like in your stomach?
No.
If you open your mouth for me?
Ah.
Say, ah.
Ah.
Okay, so I can see it's a lot of white spots and exudate in the back of the throat there. So it looks quite angry, the tonsils. So, in many ways, you're on the right treatment already because you've just started the antibiotic course. So it's been less than 24 hours, so I wouldn't expect it to have suddenly got much better in terms of the infection side. But clearly you're still having symptoms and pain. So I'm just going to tickle the back of your throat. If you open your mouth for me. Yeah? Say ah.
Ah. Ah. Ah.
That's it.
Good one. If you...
No, I've done it. Okay, so I'll send this off. Take the antibiotic course. I'll write down the medication that you can try. Whilst you're unwell, make sure you drink plenty of fluids.
That's what they told me yesterday as well.
Eat small amounts. You don't have to have a big meal straight away because your stomach needs to adjust. But if you take any painkillers, particularly this one for your throat, naproxen, take it after food, right? But I am going to give you a tablet to try and settle your stomach. Right? But if you find there's any vomiting of very big sort of brown stuff or any blood, you must seek attention again. You've got a likely infection, and most of the time these can be viruses, but I think with your situation with the pus on the back, which is why I've swabbed it, there could be a bacterial cause for this. Time is what you need to settle. All right?
Thanks, Rob.
And rest. Okay?
Thank you. Thank you
Bye-bye.
very much.
Take care.
Cheers.
Watched 50 Shades last night.
Did you?
I love that film.
I prefer the book because in my, like when I was reading the book, of course, I pictured him very differently.
Yeah.
You know, a little bit more tall, a little bit more buff, kind of, and her completely different. Which now I've gotten used to her kind of thing.
It's a smile when she goes.
Yeah, even the way she bites her lip was supposed to be a little bit more.
I know.
Never mind.
Michael Troy. Hello, how are you? Nice to see you. Come right in. Just take a seat. Oh, bang. Right, how can I help?
an appointment with you.
I know, it's, well, you know.
You're obviously very busy.
Well, it's not just me, but all doctors. I mean, there are too few doctors in the country and there's too many patients.
They're overworked.
Well, we don't mind being overworked. It's just if we had more doctors would help. So we are under pressure, but on the other hand, we enjoy what we do, but we just wish there was a bigger machine. So how can I help?
Well, I'm very worried about this pain I have. Because when it first happened a year ago, over time you expect it to heal up.
Yes.
This has just got worse and worse and worse. And it's really bad now.
It came on when you were drilling overhead, I remember. So let's look at your bloods. Yeah, so what this test showed was that your hemoglobin was low. Do you eat red meat?
Very little.
You just don't like it? It's not...
I just don't have a desire for it. I like fish.
Yeah. You never had a desire much for red meat?
I used to. Occasionally, if I can get the appetite to eat it, I'll go out and go and get a takeaway a curry.
Yes.
But they give me enough to feed about 5 people.
Yeah. So just slip off your shirt and let's have a look at it again.
Yeah.
Right. Just show me where the pain is now.
Right, it's under my shoulder.
Yeah. Yeah.
Now, if I stand up,
yeah.
So I'm doing washing up or something like that, preparing a sandwich, it comes around here.
Were you ever a smoker?
Yeah, I smoke tobacco.
How much do you smoke?
Not a great deal.
Any pain there at all?
Yeah.
Deep breath. And out. So no pain in the centre in your spine?
No.
Right, just lie flat for me. Yeah. Michael. Michael had been referred for physiotherapy and he had been on a range of painkillers and also had been on gabapentin, which is a medication that changes the way in which nerves work and which we use for relief of pain.
This is where it is here.
Put out your tongue for me. Okay. Just roll to me slightly.
What's worrying me most is it's getting worse.
Yeah, indeed. Up you come, just dress up. I was concerned by the level of his pain, the fact that it wasn't responding to anything. And when I saw Michael and his obvious weight loss, I knew that this was probably going to be serious.
I'm a bit worried about it in case it's something else.
What were you thinking about?
Cancer.
Yeah,
But there's no sign of cancer on the male side of my family. Anywhere.
Yeah, but you're a smoker.
Oh, yes.
How many ounces do you smoke?
Not a lot.
Do you roll your own? You do?
Yes. And one cigarette, I'll get about 10 smokes out of it. Because it goes out. I have been thinking about giving it up again.
Well, I'd encourage that.
The only thing is that people don't realise, and I didn't, if you give up smoking, you must also give up eating, because you will blow up.
Well, you're a long way from that at the moment, Michael.
Yeah.
So I'm going to refer you for further investigations into the pain, and we need to do some blood tests as well on you.
Sure. I'm just wondering if it's possible to get an MRI scan or something.
Well, they'll decide that. GPs aren't permitted to arrange MRI scans. It has to be a consultant, it has to be a hospital here.
I have so many things I want to do as well.
I'd be as worried as you are. So you need to do these tests, and I'll be following them up, and I'm going to refer you into the hospital. Do you need any more medication at the moment?
Yes, please.
Yeah. So just the gabapentin and the tramadol, are they the things?
All.
Yeah. Okay. So we'll see if these tests bring us any nearer the diagnostic truth, but I'm really unhappy about your continuing to smoke. Whatever is the underlying problem, it's going to make it worse. So I'd really like you to at least cut down with a view to stopping, because it won't help the present situation. Michael did not present with a history of chronic obstructive airways disease or COPD. He wasn't talking about breathlessness or cough. He was really talking about pain. And so I wasn't really thinking about all of the other conditions that smoking undoubtedly causes or is associated with. I was really thinking about what could have caused this pain, and was he a smoker? And were the two linked? So I'll stay in touch with you. We'll get the blood tests, the urine tests, refer you in, and we'll just keep an eye on your weight until we get an answer. Sometimes the answers aren't that easy to get. We've done all the other stuff we should do, and that hasn't yielded any benefit. We now need to take it further.
Sure.
Okay.
So just go to the hospital anytime?
Monday to Friday, so go tomorrow, or even tonight. There's 2 hours left. And so between 8 in the morning, 8 in the evening. I'm sorry it's continuing, but there's something going on here that we need to get put our finger on, okay? Yeah, nice to see you, Michael. Yeah.
Pleased about that now. Thank you, Doctor.
Yeah, you take care.
All right.
All the best. Bye now.
Right, so that's Wednesday, 11:10.
Doesn't look red, and I can see your TM at the bottom there.
It's fine, so it's on my jaw and my...
Yeah, because my daughter's got that, analgesia. That's all she has.
Yeah, because I grind my teeth.
Yeah, and Becky does. She really grinds her teeth.
Yeah.
Watch your feet here.
My ears hurts. I'm gonna check it now, baby. Oh.
Come through. Have a seat. Right, how can I help? Morning.
He does have an ear discharge from his left ear.
Right.
So last time when I visited the doctor, they given me 5 days of amoxiclav, and it subsided with that.
So when did he become unwell? When did this start?
Today morning, you know.
Right.
Today morning he wake up at 2 o'clock and he cried because he has an earache, and I given paracetamol 5 ml, and he slept.
So I did have a quick look before you came in. I know because of the history, he's had to go had chemotherapy, I believe.
Yes.
Where is he in terms of treatment at the moment?
Treatment, he finished his chemo last July.
Okay.
So they are looking, they are doing MRI scans every 3 months now.
Yeah.
And it's all clear till now.
That's good. George has had a very eventful life so far. When he was around the age of 3, he was found to have some developmental delay. He was subsequently found to have a tumour that's called a medulloblastoma. This is a cancerous tumour of the brain which affects an area of the brain called the cerebellum.
He wasn't walking, you know, when we were diagnosed with brain tumor. He lost his balance and he was in.
Yeah.
He improved a lot, you know, compared with the stories of other medulloblastoma children.
Sure.
He's a miracle now.
Well, that's good to hear. You must have, obviously, a lot of work for you and
of course,
parents,
there is,
having to do all this.
A lot of hard time, you know.
Okay. He's done remarkably well. He's an extremely resilient child, and his parents have been very patient with all the treatment that he has needed. What time was his paracetamol dose?
At 2 o'clock in the morning.
2 a.m. Any doses since then?
No.
Okay. So, George, I'm going to check your temperature, okay? Yeah. Can I see your hands first? Show me your hands. Great. Oh, you can do high five. Brilliant. That's good. All right. Can I check your neck in the back? Yeah. And I'm mainly checking for the glands here. Good. All right. I'll have a look in his ear. All right. So I'm going to have a look in your ear now. Is it hurting you?
Yeah.
Which one's hurting you? This is hurting you? No, this won't hurt you. Okay. So this is the one that had discharge.
Yes.
Yeah. So there's kind of mucus coming out.
Yeah.
You can see.
Yeah.
Does this happen often? Or...
Since the chemo, you know, that was the 6 months back, you know, the first time it happened.
With chemotherapy, we always have to take extra caution as the risk of infections can become more complicated as the immune system can be much more ineffective and suppressed. When he was on chemo, did he need many courses of antibiotics?
Lots, yeah.
Just as a precaution, because obviously there might be some resistance to some of the things we could give. Do you mind if we just get a swab from the ear? It's just a small cotton bud.
That's fine.
It won't be painful.
That's fine.
Okay? I should have some in this room. Right, so I'm just going to tickle your ear. That's it. Good boy.
Good boy.
You're a good boy. Okay, good. So I'll give you the prescription. And it's 1 spoon, 5 ml, 3 times a day. Okay? Good. Okay, George? Take care. Bye-bye. Bye.
Okay, thank you. Bye-bye. Bye. No. I'm going to lunch in 5 minutes.
Have a biscuit.
I don't want a biscuit.
We've got raisins in. One of you 5 a day.
One of you 5 a day.
No, one of you 5 a day.
A day. A day.
Oh, how do you say it? Day?
Day. Day?
Day?
You sound so common.
I know, yeah. They put me all around the place now. You know, change is as good as a holiday.
It is, isn't it?
What do I do for you?
Basically, I took my shoes off yesterday from work.
Yep.
And the ball of my foot,
Yeah.
I went to walk on it.
Yeah.
Can't put hardly any weight on it.
Really?
And by the looks of it, on that side, it's all swollen.
So if I press on the bone like that,
Yeah.
you're okay.
It's not too bad. You know when you stretch your muscles, when you're having a stretch.
I do that.
That's when it hurts.
Is that hurting up underneath here?
Yeah.
So if I press in here,
That is
That's it.
hurting.
okay. I don't have a foot with me,
Yeah, yeah.
but I'll quickly show you what's happening. If I can find a piece of paper. Here we go. So these are your leg bones coming down here. Underneath that, you've got a funny bone like this, and that's where the rest of your foot normally comes off from. And under here is your heel bone sticking out. Okay?
Yeah.
So that's your heel bone there, and these are your toes down here.
Yeah.
To keep, you've got an arch in the foot, haven't you? It's meant to be a bit like that.
Yeah.
And to keep that in place, there's a piece of tissue that runs from just under the bottom of the toes all the way through to there, and it's trying to keep that in a nice curve.
Yeah.
Okay.
Yeah.
Sometimes you do something and it inflames that bit there, gets really sore, and that's where I'm pressing. So I'm pressing right on that, and that kills you.
Yeah.
And it feels like putting it almost like having a stone in your shoe, isn't it? You just think, I
That's what it
can't put
feels
that
like,
down.
yeah.
So there's a big name for it called plantar fasciitis, okay? So there are 2 sorts of exercises that you need to do, okay? One of them is to stretch that calf muscle, okay? And that's the one where you put your foot against the wall and you stretch it and stretch it. And you need to do that all the time, okay? And the other one is to get a tennis ball and you put it on the ground.
Sounds silly, but it's not. Yeah.
Yeah, and you just roll it underneath that foot just to try. You're sitting down. Don't stand up and do it. Okay, you fall over. I'm going to give you an anti-inflammatory just to try and reduce some of that inflammation. But the other thing you can do is if you go to a pharmacy or you can get it online, there are things called sorbethane heel pads. Okay, and they're like a gel pad that you put in the shoes. Okay, and it cushions that area. Okay.
Yeah.
So that's what we're going to do. I'm going to give you the anti-inflammatory. You do the exercises, and you see if you can find those. I'll write it down.
No problem.
Sorbethane. And you can keep my picture. Even Van Gogh had to start somewhere, didn't he?
Yeah.
And this may be worth a fortune. You never know.
You never know.
There we go, Jules. Okay.
Thanks very much.
You're welcome.
See you
See you in a few weeks, yes?
Yeah.
See you later. Bye-bye.
Right, I'm going to do an impression of you, okay?
Yeah, go on, do me.
Right, darling. Got an appointment, lovey. Is that good?
You get me in trouble. Pauline Heron?
Hi there. Come and have a seat. Hi. How are you?
Yeah, it's still not right.
Okay.
It's not 100% right. I keep sending a letter. They give me, Dr. O'Donnell prescribed them, but he hasn't put them on a repeat prescription. For my tummy, the Lanzaproline.
Okay. How long have you been taking it?
Oh, quite a while now. You know, when it's terrible heartburn, and when it really does get to her, they just are brilliant.
Do you get heartburn every day?
Yes.
You do. Bowel problems?
I have got IBS. I
Okay.
have got, yes, I have got.
Any problems with bleeding when you're opening your bowels?
I've got piles as well, and they bleed sometimes, and sometimes I think it's just my piles.
Okay.
9 times out of
Is
10.
it bright red blood?
Yeah.
Any
Yeah.
blood mixed in with the poo? Or black poo?
No, I don't really think it's black.
Okay. Is it or not? I don't know what as such means.
I don't really examine it.
No, but you've not seen black poo.
You would have said if you'd seen Pauline, you would have.
Darker sometimes more than
Right.
Yeah.
other times.
But it's
Yeah,
been brown, has it?
Yeah.
Okay,
Yeah.
so brown is okay. Black sometimes means there's blood that's been altered that's mixed in with it. So it doesn't sound from your history like you've had that.
Yeah.
Okay, all right. And any weight loss?
Well, yes, I did, but I'm hoping to put it back on. I did put that down onto the thing.
Was it intentional weight loss?
No,
or
it
without
was
realising?
not. My sister died.
Right.
And-
Gosh. Okay.
But I don't know if I put it back on, but I was very pleased I put on this pound in a year.
Okay.
Whatever.
So you haven't put much weight on, but you'd lost it after quite a stressful time, hadn't you?
Yes, and then she's had cancer too.
Right. Okay.
I've got the all clear in October, so
Okay.
it was all.
Breast
You know, it's all been quite stressful. Probably the last 3 years, really. But it's all looking good now. You know.
Good. With this stomach, this acid problem that you're getting, though, is it okay if I examine your tummy?
What now?
Yeah.
Yeah,
And
no.
can we do a back passage examination as well?
Oh my goodness.
It involves inserting a gloved finger into the back passage to see if there's any blood or if we can feel anything abnormal there. So I get you to roll over to that side, but don't fall off the edge. Just be very careful.
Yeah. Oh, right up, isn't it?
And just bend your knees up as much as you can. That's fine. And I've got some cold gel on a gloved finger, so it's going to feel a little bit cold, but it should not feel painful. Okay. Okay, so I can see the pile there. Sorry, just deep breath in. Sorry about that. Right. Yep, so I can just see a pile, and that's it. I'm going to wipe that gel off. And I'm going to leave some tissues there for you, and you can get dressed and come and have a seat.
I wasn't expecting that.
Bin's just there.
Did you only see one pile? I thought I got...
Yes, there might be. I mean, you might have some further higher inside, but there's one that's sticking out a little bit, and that's probably the one that's bleeding because it looks red.
Yeah.
But there's nothing else abnormal from examining you, okay?
Oh.
Are you okay?
Yeah.
Okay. Now, sometimes when you're getting a lot of acid that's causing this heartburn symptom, it's because of a bacteria called H. pylori. Is that something you've heard of at all?
No, it isn't. No.
So this bacteria can cause the acid burning symptoms, and that bacteria can actually be eradicated altogether with 2 different types of antibiotics and one of these tablets that protects the stomach, like lansoprazole. To check for the bacteria, we can get you to do a poo sample and bring that into us. And if it shows that it does have it, we can eradicate it. And if it doesn't, we might need to send you for another camera test to have a look, because it's been many, many years, hasn't it?
It has.
Okay, so that's the form to bring back with this. Okay, so that's for you to take away with you, and then we'll be in touch about the results.
All right, thank you very much.
All right, take care then.
Thank you very much.
Bye-bye.
Thank you.
So how are you feeling since the discharge?
Overall, much better.
Okay.
They gave me the results straight away and said basically there wasn't anything wrong.
Yeah.
So I was pleased with that. Good.
Yeah.
So, how are you getting on?
All right. I had my first meal yesterday, my first poo.
All right, okay.
My legs were like jelly. She sent me to bed for the day on Friday, and Saturday, by mid-afternoon, it was all right again.
Your blood pressure is much better today.
Don't know, you're very happy, I don't know. It's around 130 by 80 at the moment.
No.
Yeah, so that's good.
I'm good, thank you. I've got Kerry with me. It's Kerry's,
Hello. How are you?
Kerry's first day with us.
Hello.
So, how's this leg?
You're going to be in for a shock.
Am I? A good shock, I hope.
A good shock. A very good shock.
Oh, the cream's worked then, has it?
Mm.
Oh, good.
It's what you call lovely jubbly.
Excellent.
Oh, yes.
That's what we like to hear.
Oh, it's been bleeding. Gungy, gungy.
Let's give it a little clean.
It's been a while now, hasn't it, since I've had this?
Yeah.
Oh my, it's all gone.
Look at that.
Fantastic.
That's
Oh,
lovely.
that's brilliant. That cream is brilliant, isn't it?
Yeah. Mm.
Yeah, such good stuff. And it's even helped, even the ulcer, that's totally dried up and everything now. It almost
Yeah.
looks like normal skin.
I've still got all my bruises still. There's one there, look.
Wow. Oh, that's brilliant.
Lovely, isn't it?
So you've had a week of the cream now, haven't you?
Yes.
So what do you think? I mean, I think maybe just another few days of it. Yeah.
Well, it's looking lovely now.
Excellent. So I just need to give you a couple more pads then.
Okay, thank you.
They're the smaller ones, aren't they? I've got these ones here. So you've got an appointment on Thursday then?
I've got an appointment Thursday,
So
and
just
I've got
to
two
check-
for next week. Yes, lovely, isn't it?
Isn't it?
Yes, I'm happy.
Good. So you've been partying all weekend again, like you did last weekend? Or?
No,
this
weekend.
You've had a
rest.
You've had
It's
a-
a lovely, isn't it?
70th and then a 60th.
Yeah.
So
Yeah.
we had 3 on the trot. 50,
Yeah.
70, 60.
Yeah.
So you had a quiet weekend this one
Quiet
then?
weekend this
yeah.
weekend.
No more
3 weekends
partying.
on the trots, yeah, thank you.
No more dark.
All right. Oh, well, I'm really pleased that that's getting better there, Jonathan. So.
Yes, thank you very much.
All right then. Take care. Take care. Bye bye.
Lovely. Thank you so much for your help.
It's okay. There you go.
Brilliant.
Take care.
Thank you. Bye-bye.
Bye.
All right. Take care.